So we're going to do a little bit of a talk today on, yeah, if I'm not looking at the screen, it's just I have a second screen as well. So I am focused and intent on engaging you, don't worry. Yeah, so we're going to do a little bit of a talk today on how stopping smoking can lead to greater financial well-being, but also looking at the link uh, um, between sort of, yeah, lower social economic status and smoking. So it's a bit of a weird sort of circular relationship where, of course, yeah, the expense of smoking um, can create low income for individuals that smoke, and equally worsen health, reduce health, which can then lead to people having less earning power. But at the same time, if you already experience deprivation, lower socioeconomic status, that experience can also lead to smoking as well. So it's kind of like a self-perpetuating cycle, which people can get quite trapped in. So, yeah, and I think hopefully at the end there'll be a chance just to talk, Mark, and have a little bit of interaction with people if they have any questions or anything like that. It shouldn't take too long. So, yeah, so and as much as this focuses on uh, income, finances, cost to Swindon, cost to the individual. Um, of course, you can't overlook the fact that behind every, um, behind every story and loss of health and loss of life related to smoking is, of course, the sort of the qualitative side, the stuff we can't quantify, which is the pain on families, the loss to families, the loss to the community as well. So, although we're focused quite a bit on numbers today, there is, of course, the human side as well. Okay, let's get into it. So we're going to go big picture and then zoom into low picture a little bit. So, thinking about in Swindon, um, the sort of the picture of or the toll of smoking on the local economy. So this is a really good resource I'd recommend looking at is Action on Smoking and Health, who are sort of a charity and an action group, I would say, or advocacy group, probably better, who focus on trying to make sure policy changes do occur in around smoking and that health outcomes are improved and health inequalities don't exist around smoking. So they have a really good tool where they can estimate the cost for different areas in the UK. So for Swindon, they estimate that the cost of smoking is, yeah, considerable, 145 million per year on the local economy. And that is, I often hear when I speak to people about smoking, them saying it's slowly being extinguished. It doesn't really go on anymore. And sometimes it might feel like that if you live in certain pockets of Swindon and different areas of Swindon. But there are still the sort of data from fingertips still says that 9.7% of the Swindon population do smoke, so a tenth of the population effectively, and that does create a considerable burden on, yeah, through these different routes you see on the screen. So in fact, I might just try and take away Mark's little face so you can see the screen fully. Let's see. No, I can't. But so where that actually comes from, so it's that 145 million comes from the impact of smoking on productivity. So people are, if they are smoking and have conditions like cardiovascular disease, COPD, potentially cancers. Yeah, this course says the cost of unemployment, the loss of productivity, the cost of absence as well to different organizations. Um, and equally, that 89 million. So tobacco in general creates very few jobs. It's more that the actual the people that create it, the manufacturers make most of the profits, but actually selling it to for people in stores, or the retailer, so to speak, they don't really make lots of money from tobacco. There's few jobs in it. There's lots of additional duties which the government put on it, so they don't make as much income from it. So there is a calculation in that productivity side about if tobacco industry didn't exist and we switched across to more productive, more socially focused, or maybe, yeah, different industries, there would be a greater boosting income for the local economy as well. So you've also got there quite an obvious one is healthcare costs. So of course, like consists of like primary care appointments, all the treatments related to cancers, cardiovascular disease, lung issues. Smoking is still the main cause of preventable death in the UK. So, and it's that the mortality, but also the morbidity, so like the ongoing treatment costs. And there was just on that topic of healthcare costs, there was a research from Cancer Research UK in 2023 that demonstrated that smoking, if smoking wasn't a thing, if it was completely abolished, that would free up 75,000 GP appointments in England. So I suppose when everyone's talking about sort of the NHS burdens, cost on primary care, it's just remembering how significant smoking is and how it can dominate the capacity of of these services as well. In Swindon, so once again, these are all Swindon figures. Social care costs. So, yeah, I mean, if you work in the local authority or if you live in Swindon, I think it's quite common knowledge that the predominant costs to a local authority are all, I don't want to, I can't remember off the top of my head, maybe 80% of our budget or goes towards social care. I think that's roughly right, but I might need to fact check that one. Um, so yeah, if because of smoking, of course, like I said, cardiovascular diseases, all these different things, but you're equally more likely to have other long-term health conditions like dementia, diabetes, experience of stroke, and then need care, whether that's domiciliary, residential. So I think on average, once again, action on smoking and health state that you're 2.5 times more likely to need care support at home if you smoke, and you need it 10 years earlier often. So, so it's just that idea that we're accelerating the cost of the local economy on social care, and people aren't able because of the smoking to lead independent lives. So it's and that and we know the toll sort of the cost of adult, the adult social care cost is really significant from smoking. Fire costs, it says 1.2 million there on the screen, and that's just actually from they estimate sort of 7 fires across the year, but that'd be sort of the loss to property, loss to life, and damage to sort of personal property in particular. And just good to look at because often you'll hear like, well, tobacco gets taxed, so it sort of completely overrides or compensates for the burden on the community or burden on local economy. But it certainly from Ash's figures, it doesn't. It's, as I say, brings in about 22.9 million a year to Swindon. And yeah, that's it. It doesn't, and the general estimation it covers about half the cost. So there's a real deficit brought about by smoking. And it's just remembering as well that even if because you could be tempted to say, oh, well, let's lower taxes, but actually the tax on tobacco has been seen as quite a cost-effective way of pushing people away from smoking. Where you've got to be careful, I guess, is because the low people on lowest incomes actually get motivated to move from smoke to quit smoking if costs are higher, but there's always that contingent of people who, because of the level of their addiction, their nicotine addiction, keep smoking, and those are the people which then get affected even worse. So it's Ash certainly talk about making sure the money goes into support rather than additional taxation, and I guess we've seen that recently with the smoke-free generation funding. So, um, about as we sort of talked about, it's 9.7% of the population of Swindon smoke. However, that's not evenly spread. So this is when you start to see it higher prevalence pop up and manifest in socio-economic groups, which are lower for different reasons. So, I mean, you could pick so many, but moving from sort of left to right, you've got so you've got social housing, looking at the houses. I do know where that is in Swindon, but near the parks. I can't remember where it is. But the as recently as the current national figure, if you live in social housing, the estimation is about 26% of people in social housing smoke, which is over double the rate of the general population. And as recently local to Swindon, we did say that in our 2023 tobacco control strategy that 40% of people reported as smoking in social housing. There'd be lots of sort of convoluted and confusing reasons for that. It won't all just be about, it's not as simple as saying you live in social housing, so you smoke. It's there'll be lots of different issues which we go into on the next slide. Um, yeah, and also for a tobacco control strategy, um, in 2023, that picture of the money, we can clearly see it couldn't be more. We mapped sort of the figures for prevalence from different GP surgeries against deprivation in the area, and they completely dovetailed, they completely overlapped. So areas like the highest deprivation, so Park Ward, Central Wards, Rodbourne, Gorse Hill, they did display like the highest rates of smoking. So there's a clear sort of correlation there. Once again, complex reasons for that, which I will sort of try and shed a bit of light on as best I can. But it's not just related to income and direct income and household finances. I don't know how well you can. It's not brilliant to see, but that graph at the top is just showing. I guess you'd call them professional categories, and smoking prevalence related to that. So traditionally, routine and manual workers are like so that could be your factory workers, could be working in a store, working in a shop. They traditionally have a nationally a really high rate of smoking. However, actually in Swindon it's come down quite considerably recently, so it's only just over the general prevalence. So, but traditionally that group do smoke at a higher rates, and then equally something you can see there is right at the bottom of that graph. It says never worked in long-term unemployment. They are twice as likely or have twice as high prevalence as smoking. So you can kind of once again see this weird circular relationship where people who are sort of furthest from income and money, are unemployed, are smoking, and by smoking, the health outcomes make them less likely to make income and money and contribute to society. And it's like this, yeah, it's a dynamic which creates health inequalities, and it's the health inequalities which we will just look at in the other two pictures. So unfortunately, because I'm sharing my screen, I can't move that little bit on the left hand side. Um, that's the picture there is a reference to sort of mental health. So once again, people with mental health conditions have their own barriers to employment because of the condition, because of they have their own barriers to income. Income level of income might be influencing their mental health condition potentially, but smoking rates, certainly with serious mental health, are like 4 times higher in Swindon compared to the general population, and you're twice as likely to smoke if you live with a long-term mental health condition in Swindon. So it's once again, it's the impacts of smoking on an already financially vulnerable group. Final one, unfortunately, once again, you can't see it too well because I can't move our faces there, but inequality in health outcomes. So that the graph you can't see shows that if you're an individual or a man, we go with a man. There is, I think, women are about 6.5 extra years. So basically, if you live in the least deprived area of Swindon, so picking an example, that would be St Andrews in North Swindon, you effectively you get 7 years extra life compared to one of the most deprived areas of Swindon. So that could be certainly from the multiple indices of deprivation study. It's Elding, Park South, places like, but those sorts of places. So that's 7 extra years. And Ash sort of talk about how you can say, boom, half of it is related to smoking. So the half that difference, as I say, it's the leading cause of sort of preventable death and health inequalities in the UK. So at least half of those 7 years, 3.5 of those years, are related to smoking. So it's not just that it smoking congregates in these communities, but it does create significant health outcomes, and that's not even looking at the morbidity, so the disability which might come, and the years of quality of life affected as well. Finally, moving to the central picture, which you can see, children. So so once again, Ash estimate that about 9,000 children in Swindon live in homes that smoke, or smoking households, homes that smoke, and thinking about social modeling, if you smoke, if your parents smoke, you're twice as likely to have tried cigarettes and four times more likely to smoke regularly. Yeah, I think you probably saw on the invite to this event, but the once you actually factor in Ash estimated, once you factor in tobacco expenditure into households, it's actually 30. I think we misquoted it, but it's about 32% of households that smoke do live below what they consider the poverty line. So of course, if you that it's not just about smoking impacting health and your earning potential, it's about household income and then how that in fact impacts children, whether they can get educational resources, um, whether they have access to maybe cheaper foods. Pound for pound, unhealthy foods are cheaper, so that may impact their diets because of the lack of income as well. So it's once again quite sort of sometimes quite indirect ways that smoking can impact families and health in Swindon. And of course, if you're a child growing up in a home with secondhand or passive smoking, yeah, childhood asthma, allergies, you're more likely. If a child, if it's still surprising to me that sort of 6.6% of mums that are pregnant do smoke. Currently, that's what the Office of Health Inequalities um, and yeah, the OHID, but what OHID suggests is the number. So there's still, and of course, if you smoke when you're in pregnancy, you're more likely for sudden infant death. So it can be a real toll on children as well. Um, the burden of smoking. Okay, so I get it's a really common question I hear as well is like and it can actually be it's kind of like a bit of a loaded question sometimes. Well, why do poorer people smoke? A bit of a Daily Mail headline style attack. But I've heard people close to me in my personal life say it as well. So yeah, for our tobacco control strategy, we looked at the six main drivers of smoking in Swindon. Um, Firstly, I guess you got to remember that it's when you smoke nicotine, well, when you smoke a cigarette, you have nicotine hits your receptors in your brain, and and it creates there's that dopamine, a slight increase in serotonin, a feeling of relaxation. So and that can be very addictive. So once you've had that a number of times, you actually yeah, it's that cycle of nicotine withdrawal. As you withdraw, you start to feel more irritable, more anxious, and then you use the nicotine again to get that momentary relief. But it's not sustainable, unfortunately. So outside of the addiction, you can see how all these uh, different drivers sort of play into each other. So if you think of an individual growing up in an area which is quite deprived in Swindon, um, they may be more stressed. They may have an experience of poverty. They might have lower expectations from life potentially. Not all, just to be very clear, not all, but there can be a trend there, and that can impact people's mental health. And if you people report using smoking to manage mental health. It gives them a momentary relief from their stress. Um, it's it's that perception of pleasure, but as I say, it's often just curing or resolving the nicotine addiction momentarily. Um, and then, of course, if you've got experience of mental health condition, um, or if you live in let's see, so no, if you live in so we know that in areas of um, deprivation, um, that historically, I think we've done a pretty good job of trying to reach through different partners and making sure there's support options in communities in Swindon as well. But historically, you might not see as many campaigns. You might not see, you might not hear from peers, like different routes to support, and that all plays into a less likelihood of of seeing smoking as a problem and finding a route to quitting it as well. Um, On top of that, we talked about the tobacco landscape. So once again, historically, um, things like illegal tobacco and well, even stores that yeah, there can be a greater density of outlets which sell cigarettes and tobacco in areas of deprivation. So once again, that links into your more another driver sort of conflating with another driver and making that more likely. Um, Equally, social norms is a really big one. So we talked about earlier, if you as a parent you smoke, your child is can be up to 4 times more likely to smoke in the future, and all those different factors just drive together. You may not have other coping mechanisms, which you've learned. Potentially, your area has less outlets potentially. So it's how those things sort of all map together, and that's what the people who smoke reported to us during our 2023 tobacco control strategy and how that drives collectively smoking rates in Swindon. Let's get on to the positive part. So, um, there are routes to quit and very effective routes to quit. Um, and many of these have a sort of modified to reduce cost barriers to make sure that the most vulnerable in Swindon can, or most financially vulnerable, can access. Um, oh, look, here we go. I can actually move it. There we go. Brilliant. There we go. And I'm learning as well. Great. Oh, look, it's popped up on the other screen. But yes, yeah, what I'd say is, here we go. Yeah, so the ways to quit. So currently, we offer the swap to stop scheme in Swindon. So that is, yeah, if you based on the evidence, if you use a vape, which is significantly less harmful than smoking, um, if you combine that with behavioral support, you're about 4 times more likely to stop than if you went cold turkey. So that's a really good way to quit, and you get a free quit. So um, it's I think the cost of one of our devices we use through our provider, Totally Wicked, is about £72. So that's the starter kits cost about £72. So you're giving that person an opportunity. So on any income, they can access that, and after 4 weeks, they would have to fund their own liquids and vapes, but it gives a person that start on to quit smoking. Equally, you've got nicotine replacement therapies, which are on evidence and just behind vaping as on effectiveness for quitting, where you combine sort of things like patches as a slow nicotine replacement with something like a spray or a fast acting NRT like a lozenge or a gum. Um, and equally there's medications as well. So we recently Varenicline is a previously known as Champix is back on is sort of approved in the area to be used, and there are ways so that sort of works over 12 weeks, but um, yeah, you can there are by using something like a prepayment prescription, which you should be aware of for people that are smoking and quitting, they can get in advance sort of 3 months of medication. So and that would lower it, so you get it for £32.05 compared to what the cost would be if you're buying them individually. So there are ways of making quit attempts, and of course some people may have free prescriptions anyway for health reasons or for whatever reason. Finally, the other one I would bring up around sort of quit routes and finances is just we're right on the cusp. You'll be hearing more about this in the coming weeks of launching a smoke-free app, and that's where people can get a free license, lasting up to 6 months to use an evidence-based app, which entitles you to where you can access all the different high evidence quit rates. But equally, you can get things like certain games, certain tools, certain groups. You can access sort of peer support on there. So it's a really versatile tool, which there is evidence of sort of 57% of smokers quitting after 4 weeks of using that app. So really positive, and an easy a way for potentially people like maybe shift workers, people on different working patterns who can't access their local stop smoking service, to access it in a bit more of a free way or a liberating way. So, yeah, I would also just throw in actually that, particularly for, I mentioned earlier that there are rates of about 6.6% of pregnant mothers in the UK, not in the UK, in Swindon, currently do smoke. So we do have a smoking in pregnancy team, which we commission, which are based up at the hospital, and they are currently doing offering a pregnancy incentive scheme. So that's where they organise that, but it's where you basically if that person keeps returning or that pregnant person keeps returning um, proven but through a CO monitor you can assess whether someone's actually quitting smoking. If they keep returning those clear like showing that there's no carbon monoxide in their system, they do get vouchers, financial incentive to keep not smoking, and that is or to quit smoking, and that is evidence based. So it's good to see that route opening up to people as well. And just quickly run down I don't want to take up all the time with me speaking. So down the right-hand side, you can see, yep, so reasons to quit from a financial side, 2,000 on average. So this is just for like someone who smokes sort of 10 a day, I believe, about £2,338 a year on average back in that person's pocket and going towards their household as well. Of course, if you smoke, people do report once they quit smoking, you've got the long term stuff. So after 10 years, risk of death from lung cancer falls to half. After 15 years, your risk of heart attack falls to the same as someone who's never smoked. So that's obviously going to increase your earning potential if haven't got those long term health burdens hanging over you. But equally, mental health. So people report saying that once you're free of the initial nicotine withdrawal, um, yeah, but being free of that sort of anxiety, those cravings, the irritability, the headaches. Yeah, actually, the overall outcome is improved mental health as well. So that is a really significant factor around making you more likely to be able to be employable or making someone more likely to be employable. People that do move to vaping, so this is usually estimated. This figure is from our provider, but it often reported as sort of like about a third of the cost, and it's even less on this particular summation. And of course, like we talked about earlier, so smoking in lower socioeconomic groups does create it's like that intergenerational cycle of people of health inequalities becoming entrenched in certain communities. So like you're ending that cycle, passing on, you're sort of reverse modeling to your children if you do stop. And hey, like changing any behavior, there's rewards. I mean, 2,338 pounds. What do you want to spend that on? I'd be excited to have that conversation with individuals. So that's definitely something to be talking about with the people of Swindon. Where does that money go? So final page, and then we can open it up a little bit. So what can you actually do if you're a partner organization listening to this or watching this on YouTube later? Well, I would recommend the 5 things. There's loads more you could do, but the 5 things you could do is make sure you have done your very brief advice training through the NCSCT, the National Centre for Smoking Cessation Training. I certainly believe before I started in this role that it was wise just to ask people, do you want to stop? How much do you smoke? But there are evidence-based ways to actually raise the topic of smoking. It's the offer of support that is the most effective way of creating quit attempts. Um, how much someone smokes, there's no real safe level of tobacco, and equally, if you ask someone if they want to stop, offer sort of predominantly they come up with reasons not to. So there's good evidence behind very brief advice, and there's really simple, probably only takes half an hour. So I'd really recommend like everyone in different organisations doing that. Join our Tobacco Control Alliance. So each month we send out a newsletter with the latest resources, latest activity, so you can be aware of what's going on in Swindon, and which might benefit people that you support, some of your either clients or individuals you work alongside, and it's not just a one-way dialogue. If we do have members of our alliance that want to set up specific schemes around whether it's swap to stop provision to the people they support, whatever the case may be, it's a dialogue on how we can together address smoking related harms in Swindon. Get involved is number 3. So every year we have 3 main campaigns. New Year's is all about behaviour change. Stop Smoking Day in March and Stoptober. I would say if you have, great reshare our posts on the internet. We do have a lot of smoking related comms, which goes out maybe one or two each month, maybe sometimes a little bit less, but those can be reshared by organizations tweaking it to your needs as well. You can create your own content. You can record quit stories. That's always a really good way of inspiring others by rather than focusing on smoking harms, the benefits of stopping as well. So that's a good way of encouraging people. Don't know who we have on the call, but another good one is just thinking about smoke-free environments and how you can change your workplace to be smoke-free. And that's the higher end of the scale is things like, well, we've got a smoke-free environment. You can't smoke in here. That's going nuclear, so to speak. You can, it's on a spectrum. So that could be something as simple as making sure you record the smoking status of staff or people, people you come into contact with. Making sure there's maybe just one smoke-free champion that is trained, and I'm certainly always our public health team always happy to work with people to make sure those smoke-free champions know the most effective ways of offering support and getting people quitting. It can be simple things like looking at your policy of your organisation. Do you allow time off for stop smoking appointments? And making sure there's clear literature everywhere and quit routes which are promoted. And then finally, you've got the referral routes there as well. So anyone that joins the local stop smoking service is 3 times more likely to quit. You can bring that up to 4 with certain quit aid. So I think that's really the message to leave people with, is that although there's that whole backstory of sort of entrenched health inequalities around income, there are routes out of it, and there's ways we can shape society to alter that trend. So yeah, that's me really, and it'd be just good to open up the debate a little bit and talk to yourself, Mark.
Talk to myself. Thanks, Mike. That was really interesting. Thanks ever so much for that. I will share the slides as well on the probably on the bulletin, with the bulletin actually, together with the link to the recording.
I'll put some because we talked about swap to stop and stuff. Just make sure that I'll put the link, send across the links to you, so you can send them out to people as well, because that so people have got those quit routes to send on to people if they want to.
I was just that would be helpful, but I was just finding them whilst you were talking. But the links will be good as well though. And I found the live, because you can go through the Live Well team as well, can't you? To access the coaches. So can you tell us a little bit more about that? The kind of services that are available. If someone were to contact the kind of stop smoking service.
So if you let's imagine that someone emails in to our NHS email, the stop smoking service I had on the slides. Can't remember the email off the top of my head, which is a shame. But from there, so if you think about our local stop smoking service, you've got the specialist service, like you said, Live Well. So that could be, they might get referred from there to Live Well. They would be triaged, and they would just define which route would be actually best for them. So it might be a stop smoking health coach, and they can work with people up to 12 weeks around and give all the major sort of evidence-based quit routes alongside behaviour support. And that behaviour support is really important to look at. Could be smoking such a ritualistic behaviour. So what friends are particularly what friends are particularly at risk factors to you if you're trying to quit smoking? What's your motivation? All the use even little things like talking about restructuring your environment, so you're throwing away your lighters and things like that. All different kinds of tips and behaviour support. So that would be through Live Well, but equally for a lot of our pharmacies in Swindon and for a lot of our GP surgeries. Not every GP surgery. And not every pharmacy, but there is stop smoking provisions there as well. So if you start at that email address, you can have a triage call and just see what's nearest to you, what's easiest. And once the smoke-free app comes out, that would be another link we can send out, because that's a route which doesn't need to go through that. You can sort of download the app yourself and tackle quitting.
Fantastic. And just one more from me. in an age where you spoke a lot about finances and household income, is this means tested, or is this a universal service?
Yeah. No, it's not means tested at all. Sorry, it's like yes, the local stop smoking service. Anyone can access that regardless of income. We do try to target resources where health inequalities are at their highest. So, for example, I notice I might be saying that name wrong somewhere. I always get that name wrong. Apologies, but Maylee from housing. We're currently working with the navigators in the housing team to try and who are offering swap to stop to people who are either vulnerably housed or homeless. So we do try and target resources specifically, but anyone can access the local stop smoking service. I'm trying to think of the cost involved would only be if you paid for your prescriptions. That would be the only cost involved. But and as I say, there are ways of lessening that with prepayment prescriptions and things. So no, absolutely not. It's a free service for everyone. Yeah.
Fantastic, fantastic. Let me have a quick look. We do have a question. So, right, I'm going to try to. Aaron has got a question. I'm going to see whether I can
Maylee, I'm glad I got it right.
allow him with his mic and his camera, and if he wanted to, he could make himself heard or make himself seen.
It worked.
Hey, Aaron. Hi.
Hiya. How are you, Mike?
I'm not too bad, Aaron. Really good to see you. You remind me of the pandemic, but in a positive way, talking to you at that time.
Yeah. I think really just a very quick question. I'd say generally sort of the main thing that the parish can do, and I'm assuming other parishes can do, is kind of amplify the message by using our social media and notice boards, etc. So yeah, keep an eye on Swindon Borough Council's comms and repost. But in the meantime, do you have any sort of existing media assets, whether that's posters I can get stuck up in the community centres and libraries, or even just a handful of already prepared messages we can stick out on Facebook, etc.
Definitely. I love the energy, Aaron. I love the energy. Yeah, so just even speaking to you there and hearing sort of the passion for trying to reduce smoking and tackle smoking related harms in your area, I would say, if you're happy, we can add you to the Tobacco Control Alliance. You might already be a member. I'm not sure. Possibly.
Yeah.
I haven't. Well, so if I don't know if you circulate the emails afterwards, Mark, do you, or if I'll make direct contact with Aaron, whatever works. But yeah, we do have some materials that we can send out to you, like posters, some really good ones around sort of the benefits of quitting smoking, which give that sort of more hopeful message. Also look into each month when we do comms. See if you are a member of the Alliance, I'd like to get to the point where we can send out what days a post are on, so it just makes it a bit easier for you to track down that post and then I'm not too good with reshare.
Yes.
Not too good with social media, but so yes, there's definitely, we can make sure you get some contact cards out to you for the local stop smoking service as well. So I'll follow that up as long as I find a route of getting your email.
Brilliant. All right. Cheers for that, Mike. Thank you.
No, thank you.
Thank you. Just to say, you had a meeting. Oh, is it 2 weeks ago now, Mike? Your Tobacco Control Alliance, and it was really interesting. A lot of energy in that room that day, wasn't there? And conversations not just about you must stop smoking. It's very much looking at going much deeper dive, isn't it? But also looking at solutions.
Definitely. Well, like I said, there's so many there's myriad ways and drivers of smoking. It's not always I suppose I didn't grow up in this environment, but if I grew up around having a presence of smoking constantly in my life, I would have it socially modeled to me. I would see it as more normalized. I'd probably be in line to receive more less negative information around smoking, maybe quite people like saying it, promoting it, figures around me promoting it. So it would just shape my opinion. It's just, so we can't always choose with health inequalities, like the environments we're born into and how we view smoking, but we can try and address it later on in the channel. And yeah, I agree. The Tobacco Control Alliance was great to have a lot of professionals in one room. It's one of those great, it's not a great issue. It's one of those issues that has to be addressed as a system because, like it's like we say, it's impacting GP surgery, it's impacting hospitals, it's impacting the financial side, which you'll have a lot more knowledge on in Swindon. You'll see it we go to food banks, so you see it really plays out in all sorts of ways in Swindon. So it's a real collective issue, and it was good to have the energy in the room on that day.
Yeah. And just one more thing, and I might be throwing you under a bus here, and I do apologise.
No, I was waiting for this.
Swap to Stop, are you still looking for partners or people to support that, or referrers?
Yeah, so we are we're definitely looking for people to refer to it. And if we're always looking at different ways of trying to reach priority groups. So I would just say yes to answer your question. We would definitely help people do the training around Swap to Stop. There's some training that if staff feel or if different organisations feel they have capacity to help us with that, I would be really happy to support people's training. Most of it's online, and then get them set up with either physical kits to hand out to people that are smoking, or codes which you hand out to people, and then they redeem the codes online. So yeah, that would definitely be something we'd be looking to do as well.
Fantastic, thank you. I'm glad the bus didn't run over you completely.
No, that wasn't a bus. That was an invite.
That was an invite. Oh, that's good. The bus is coming and it's on its way.
Yeah.
Fantastic. Well, thank you for your time. Just a final call then. Anyone else got a question? I would say a burning question, but that might not quite be the right term to use. If so, you can either pop your hand up or pop it in chat, or it seems to be a Q&A thing there I've never used before. Here we go. Right, I'm going to allow mic and allow camera, and I think you should be able to.
Here I am. Can you hear me?
You can. You've been given your freedom. Yeah. Yep.
I won't put my camera on because I don't want to scare anyone on a Tuesday morning. But it was just going off of something that Mark had asked. Actually, I was going to ask the same question about sort of partner agencies using the Swap to Swap. So are GPs using it at the moment?
There are So a lot. So not every GP practice, but in Swindon, some GP practices have a smoking cessation practitioner, and those to my knowledge, all of those will have access to codes and things like that. So if people went to a GP surgery, they should have access to Swap to Stop as well in Swindon. They can obviously go the route of just through our website, which Live Well administrate and support people with over 4 weeks. But yeah, there is support as well for Swap to Stop through your GP surgery.
Okay, that's good to know, because obviously we're using the referral to refer people into Swap to Stop, but sometimes our customers don't have the time right there and then, so it's good to know that we can possibly just say next time you're at the GP, you can also do it there. No, so that's great. Thank you so much, Mike.
Yeah, I suppose some of the people you'll be working with, I assume they have maybe I don't know how access to IT and things like that. So getting online maybe to do it might be difficult. Just to say they can always walk into Live Well as well if they're like town centre based, and they can organise appointments, things like that, and go from there.
That's great. Thanks so much, Mike.
No worries. Good to hear from you. Take care.
Well, once again, Mike, thank you so much for your time this morning. It's been really interesting to hear all those things. Both, we could chuck the stats around and say, it's this and it's that, but actually, some of those positive things as well that we can all get involved with, but that the services that you're offering as well. Kind of put it all into perspective and kind of show that light ahead of us as well. So thank you.
Yeah, thank you, Mark, for the opportunity. It was great. Really appreciate it.
As I say, the recording will be on YouTube later today, and I'll make sure I send the slides out and together with some of those links as well. So
no problem. And I'll get in contact with Aaron. So that'd be grand.
Fantastic. Thank you so much.
Thanks a lot. Have a good one, guys.
Great day, everyone. Take care. Bye.
Bye-bye.